All right, well, let's get started. So just wanted to welcome everyone and thank everyone for their time and attending our webinar today. We're going to provide an overview and an update on our quality improvement program. We've undergone a significant transition and change over the past number of years and introduced a number of quality improvement based options for physicians to participate in. My name is Dr. Ted Everson. I'm a medical advisor at the CPSO, and I work and support our quality programs. I'll be accompanied and we'll jointly present today by Dr. Mary Manno, and as well our Director of Quality Programs, Mary Bayless, as well as our Manager of our Quality Programs, April Jacobs. They will be supporting the presentation as well and happy to track some of the discussion and chat and questions. So maybe I'll have, if Dr. Manno wants to introduce herself.
Thanks, Ted. Hi, everybody, and welcome. As Ted mentioned, he and I are both medical advisors in the QI program. I lead the part of the program that's designated QI for individuals, and we'll be talking a little bit specifically about each of our areas. I just wanted to say that I'm a family physician by training, and I've had a special interest in teaching, mentoring, and coaching throughout my 35 years in family medicine, and I'm delighted to be part of the development of the quality program over the last 2 years at the CPSO. We've been doing some very exciting things, and I'm hoping that our enthusiasm will rub off on all of you. Back to you, Ted.
Great, thanks, Mary. Just before we get started, just a couple housekeeping items. For questions, we'll ask that you put any questions into the chat box. We'll track those and we'll try to hold and go through the questions at the end of the slide presentation, probably in about 25 or 30 minutes. And so if you could put them into the chat, we'll monitor them and then try to get to them at that time. The presentation, this is going to be recorded and we will have it saved and accessible for future reference and for future access. Just in terms of the format as well, Dr. Manno and myself are going to be going through some slides that go through the background on the program changes that we've embarked on, and as well go over the current state, and then we'll do the questions at the end. So in terms of the objectives for our presentation today, we want to go over and explain the transition and evolution of our quality programs, and specifically how we at the CPSO have transitioned from a quality assurance approach to the adoption of a quality improvement approach and strategy for our quality program options available to physicians. We will review the tools that we have at the CPSO located online that support self-directed quality improvement for physicians, and we provide access to those tools for physicians registered and selected for one of our quality program options. And then we will go over and review the current state. So what are the new quality improvement program options that are available to physicians? We'll provide our experience to date and kind of what we've learned so far and next steps. I'll start by going over this slide, which has our mission statement. So our mission at the CPSO. And as well, this slide outlines our regulatory principles. And when we're talking about the current state of our quality program and all of the changes that we've made over the past few years, we've based those changes on our principles. So things such as quality of care, we want to support physicians providing high quality care to patients in Ontario. Certainly, we've adopted a continuous improvement principle to the transition, and we've learned a lot to date with the programs that we've rolled out, and we continue to make adjustments and changes based on experience of our physicians with the programs and things that we're learning related to that. The one principle that I'll also mention is something called right touch regulation, and I'll speak briefly on that. Right touch regulation is another one of our principles at the CPSO, And it's something that we try to apply and integrate into all of the work that we do. So not just within our quality programs, but also in different areas such as investigations, in registration and licensing, in policy. So we try to apply and integrate the principle of right touch regulation to all the work that we do. And what right touch regulation is it is a framework, and it helps support determining our level of involvement in a particular issue or in a particular area. And that is based on a risk evaluation. It's outcome focused. So at the college, we use this as a framework in the different areas we do, and we've certainly used right touch regulation as a principle in the redesign of our quality program options. Some additional background information. We'll talk a little bit about our quality program history and background. So quality at the CPSO, this is embedded in the quality assurance regulation, where it outlines that all members with an active license must participate in one of our quality programs. Historically, and for decades, this was generally through the random peer assessment program. And that program was designed to have an interval of approximately once every 10 years. So once every 10 years, a physician would be selected for a random peer assessment. Now, based on our experience with the peer assessment program and based on an evolving body of literature around the benefits of quality improvement, starting in 2019, we started to transition to the adoption of a quality improvement basis as an options for our members to participate and interact with our quality programs. And we'll go into that in a little bit more detail. Now, certainly our peer assessment program still exists and is active and is an important part of our work at the CPSO. And an example would be that we still do regular age-related assessments for our members that are over the age of 70 who would be required to have a peer assessment every 5 years. A little bit more on our background. So with our previous quality assurance peer assessment program, we had been doing approximately 3,000 assessments a year. And when we looked at our data over that time, we know that approximately of those 3,000 assessments here, approximately 90% of them, no problems or issues were identified. And in fact, in the 10% where there was something that was identified, a significant part of those were low risk or low level issues. And so when we reflected on that experience, there's a couple of important takeaways. Certainly one is that physicians in Ontario the majority are practicing at a very good level and providing a very good level of quality of care. And certainly we heard the physician experience with peer assessment and that it certainly could be a stressful experience. So, looking at that experience and in the context of the potential benefits of quality improvement, we certainly thought that there was a rationale and good impetus to make a change. This slide outlines the quality assurance approach, which was our random peer assessment program, versus QI and outlines the differences and the potential benefits. So with a quality assurance approach, and this had been our experience at the CPSO, there's really an impact on a small number of individuals. And so a small number of individuals going through a quality assurance approach ultimately made any changes or were encouraged to make any changes with their practice. The bulk of the membership practicing at a very good level. Whereas with a quality improvement approach, there's the potential to have a bigger impact or shift on quality, even when we're interacting with a group of people that are practicing at a very high level. So the potential to have a bigger impact and shift on quality exists with a QI approach, and I think this slide outlines that fairly nicely. In terms of some additional background on quality and understanding the differences between quality assurance and quality improvement. So quality assurance is really an audit-based approach in assessing if a physician is meeting a minimum standard. It's done by a peer assessor, whereas with a quality improvement approach, it is more of a self-guided process, self-directed. We do offer and provide support through coaching. So we have a group of physician quality improvement coaches that are available to support members. And really it can be about going past the minimum acceptable standard and for all physicians making some changes and potentially improvements. As well, an audit-based approach in quality assurance is really looking at care that has been provided in the past, whereas a quality improvement strategy is more forward-looking and looking at care that is yet to be provided and making some changes that could impact care certainly going forward. So that's just another comparison between the two strategies and approaches. And with that, I'll hand it over to Dr. Manno to talk a little bit more about our current state.
Thanks, Ted. I'd like to talk first about the QI program for individuals, which has been in operation for 3 years now. We started out in 2019 with a pilot of 260 family physician volunteers and who helped us develop the program, which is still in evolution, as you will see. In 2020, 1,700 family physicians were invited to participate, and these were invited randomly. In 2021, 6,000 members were invited, and these began to comprise other areas of specialty, including psychiatry, radiology, internal medicine, anesthesia, and surgery. And in 2022, we have 4,000 members invited into QI for individuals. And as well, we now have an exciting group subset operating within QI for individuals. And we have physicians from a variety of practice settings and specialties joining us this year. Next slide, please. So we're thinking about QI individuals in terms of this 5-year cycle. And the idea being that as members are invited into the program, they'll have an opportunity to connect with online learning materials that are housed in the quality improvement activities, of which there are 3. And they're listed here. One is practice profile, another is a self-guided chart review, and the third is data-driven QI. We do have the option later in the presentation of going into more detail around the quality improvement activities if that would be helpful to the participants. But I think we'll stay at a general level for now, and then we can come back to more specifics. The idea when completing the online activities is that one should be able to reflect on one's own practice with some input from a trusted peer in order to lend an element of objectivity. And also to be encouraged to look at data that could be derived from observation of one's own practice, or it could be data that's being pushed to the physician from a third party, like Cancer Care Ontario, for example. And we can come back to this later if people have questions about the use of data for QI, because for many of us, this is a very new idea. Even the idea that there's data out there to be gathered and to be used for quality improvement to some of us is new. Having completed the 3 quality improvement activities online, next comes devising a practice improvement plan that relates to the physician's own improvement goals. And very often those goals arise from the 3 activities that were completed earlier on. And so we encourage members to complete the activities in order. And as you're going through them, to think about opportunities for improvement in your everyday setting. The practice improvement plan is also completed online, and there are certain stimulus questions that assist the participant to describe a minimum of 2 and a maximum of 4 improvement goals. And a very important component here to me is the fact that one of the goals for improvement has been set aside potentially to highlight physician health and self-care goals. In other words, each member will be coming up with a minimum of 2 and a maximum of 4 goals. One of those can be aimed at physician health and self-care, which is an important priority at a time when we're all feeling the stress of the work that we've been doing over the last couple of years. Then the practice improvement plan is submitted online and then comes to the attention of a QI coach who reviews the plan and gives feedback to each member, written feedback, which is all dealt with through the members portal. And again, we can come back to some of the specifics later in the presentation if that would be helpful to folks. Next slide, please, Ted. So when there are cases where the coach reads the practice improvement plan and feels that some of the members' goals could be further developed or enhanced. And so in those situations, we offer coaching, and that's a conversation that can occur by phone or virtually using a platform like Teams to 45 minutes, an hour discussion to review the goals and to help the member to enhance them as needed. And I think this is currently happening perhaps 15 to 20% of the time that individuals would be invited to coaching. And the issues that sometimes need attention are clinical care, practice management, or wellness issues that have come up during PIP review and been identified by coaches. Next slide. So an exciting development in QI for individuals this year is the group subset. So it's now possible for a CPSO member to be invited into QI for individuals and then ask up to 6 colleagues to participate with them in producing a group practice improvement plan. And the way this works is the individual members of a group complete the 3 online learning activities individually and then come together to look at data in order to develop group goals that can be expressed in a group practice improvement plan. So one practice improvement plan gets submitted. So it's a pretty exciting option. Next slide. So just to summarize, at this point, in terms of the group subset, we have 4 groups that participated in the pilot in 2021, and for 2022, we have over 75 groups having self-identified to participate in the program in this way. Most elements will remain the same as the QI for individuals, but the difference is that the physicians submit one group PIP instead of individual PIPs. Next slide. And I'll hand it back to Ted now because he's going to talk a bit about his area of interest, particular interest, which is QI partnership.
Great, thank you, Mary. Right, everyone. So we'll talk about another QI program option that we've launched, and it's called the QI Partnership Program, which is an option for physicians that have a hospital practice, or at least a component of their professional work is within a hospital. So again, just to reset on the current state, we've talked about our QI for individuals program as well as the group subset, and this is another QI program option called QI Partnership. That is an option for hospital-based physicians. And just as a reminder, our quality programs are now based on a 5-year interval. So previously we had been designed around a 10-year interval, but one of the things was we did want to have more frequent engagement and contact with our membership, and this is now on a 5-year interval. In terms of the QI Partnership Program, so again, with our interest in engaging physicians in doing quality improvement, and really good evidence around the benefits of that. We know that if we can engage physicians in quality improvement, it's a great way to change or improve clinical practice. And in the context of the partnership program, this was designed to help support hospital priorities. So we know that if we can engage physicians on quality work within the hospital, it is a great way to kind of drive and accelerate change and important improvements. The other feature of the design of the partnership program option is that we recognize that many physicians in the hospital environment are already active and participating in various quality activities. And this program option is a way to kind of acknowledge that and recognize that, and hopefully avoid some of the redundancy of the various requirements that we have as practicing physicians, and avoid some of the duplication of effort. So, for a physician that is already doing and participating in quality work, there's certainly an option for that to be recognized and to be integrated in the context of the partnership program stream. So what is the QI partnership program? It is a program option within our quality programs that's designed for physicians to participate in a hospital QI project with their colleagues. And by doing that, they will be eligible to meet their CPSO quality requirements for a 5-year period. They're required to also do the 2 online QI reflective activities that Dr. Manno had mentioned in the overview of the QI individuals program, and we will circle back to that later in the presentation. As well, with the partnership program, in terms of looking at system collaboration and healthcare system collaboration at that level, we're encouraging that the QI projects that are submitted are aligned with something that is important to the physician's organization. So if an organization or the leadership at an organization has identified a quality issue or a quality metric that they want to work on, this is a potential opportunity to engage physicians in that area, because of their participation would then support them in meeting their CPSO quality requirements. In terms of what you can submit, so if you are interested in the QI partnership program, what can hospitals submit to us? And really, it's flexible. So the nature of the QI project, the scope of the project is flexible. I think that there's a couple of important considerations when you are deciding what to do as an organization. One consideration would be to look at the resources that you have available for a QI project. So in terms of any quality resources, existing quality infrastructure, physicians with protected time, existing QI expertise, all those I think are important factors that would help influence what you decide to do and the scope of what you decide to do. And we recognize that there may be significant variability with those factors, and that's fine. We want you to submit something that is practical and feasible for your hospital. The other consideration in terms of deciding what to do is something that I just mentioned, is that if there is an important area or initiative that you want to work on or launch, or if there's a quality metric or metrics that you want to focus on, we're hoping to frame this program that this is a great opportunity to engage your physicians in that work and in that activity because of the other benefits that they would get for their participation. So, at the bottom line is that what you decide to submit as a partnership project is flexible and can be influenced by factors that are unique to your own environment. To date, we've seen most organizations submit 1 or 2 larger scoped QI projects that almost all of their active staff can participate on. A smaller number of organizations have elected to submit multiple QI projects that may be at the departmental level, but we leave that decision making to you and what works best for you and what is most meaningful for you. When you do get to the stage of submitting something, you submit a proposal to us. We have a proposal form that organizations use to guide the design and submission of a QI project. It follows a fairly standard QI project charter format. So you identify a problem statement, you identify a name statement, you outline some goals and objectives. We certainly encourage the use of data, whether that's quantitative or qualitative data, to support the project and any intervention and measuring that. I think a couple of the key elements and for a physician that is going to participate is really how are they reflecting on the project, on the content of the project, on any data, and how are they getting connected to the project with an opportunity for feedback, whether that's in a group setting and or in an individual setting. Again, how that looks is going to be influenced by the nature of the project, but certainly those are some important parts to design in as the reflection and feedback of a physician that is participating. So what are some of the key messages with the partnership project submission? For physicians, we recognize that there's a number of requirements that we all have as practicing physicians. And so by participating in one of our QI programs, and this includes partnership, you can meet your CPSO quality requirements for a 5-year period. You can certainly also concurrently claim CPD credits, whether that's with the Royal College or with the CFPC. For hospitals, for physician leaders at hospitals, we're hoping that you can utilize this program to engage your physicians and to help drive some relevant quality projects or work that you want to do because of the other benefits that physicians will get aside from just having an impact on the care that they're providing or the model of care that they're acting in. And I think I'll pass it over to Dr. Manno to provide some summary and overview of what we've talked about so far. You're muted, Mary.
Famous words. Sorry about that. What we've tried to capture in this slide is a summary of the options along the column on the left for the various aspects of the program and the activities that that particular stream requires. So QI for individuals, QI survey is basically a description of the type of practice that one does. Practice profile is an activity, an online activity that allows you to look at the risk of a college complaint in your own practice environment and how to mitigate that risk. Self-guided chart review is an opportunity to actually look at the quality of your record keeping and then involve a trusted peer in reflecting on that. Data-driven QI is an opportunity to think about how to use qualitative or quantitative data to look for and measure improvement. The practice improvement plan submission, all those elements are common to QI for individuals. Whereas in QI for individuals group subset, the first 4 activities are done individually and the practice improvement plan is submitted one practice improvement plan on behalf of the whole group. Whereas in partnership, the 2 required activities to be done individually are practice profile and self-guided chart review. The hospital's QI initiative is the piece that's submitted to the college. And that's contrasting with the QA approach, which requires the participating physician to complete a practice physician questionnaire and an on-site practice assessment, which generally lasts 3 to 5 hours. And I think we clarified that the QA peer assessment approach is currently being utilized mainly for physicians over the age of 70. Next slide, please. So our experience to date. In QI for individuals, we've engaged with approximately 5,000 CPSO members since 2019. I mentioned that new for 2022, we have 77 groups that have self-formed in the subset of groups. And each year we anticipate that additional specialties will be invited to participate. And we can offer some flexibility in that members are now able to choose their preferred deadline for completion once they receive their invitation to participate. And in QI partnership, to date, we have 26 hospitals who have whose QI proposals have been approved. Some are organization-wide and some are department-focused, and it constitutes a variety of large and small community-based hospitals. So overall, what are the benefits of the QI approach? This is an opportunity for reflection on what we do every day, and sometimes it's interesting to step back and look at the big picture. It's also an opportunity to set goals that are meaningful and relevant to the individual clinician or group. It's a wonderful way to obtain CPD credits. And from the college's point of view, it allows us to have more frequent contact with physician members and ultimately have a broader impact on the quality of care throughout the healthcare system and fulfill our mandate of public safety. Next slide. I think this might be a good time to stop and address any questions that may have come up in the chat. And Mary Bayless and April Jacobs are in the background helping us to formulate those questions.
Hi there, Ted and Mary. There are some questions in the chat. April and I have tried to answer some of those questions, but maybe you could speak to a couple of them.
Sure.
So one of the questions is, if choosing a group QI project, do the physicians need to be part of the same group practice? We have answered no, of course, but maybe you can give some rationale for that.
Sure. There are many instances where physicians are working collaboratively, but not necessarily co-located in a practice. For example, in my practice setting where I worked in a FO, we shared an after-hours clinic. So even though we weren't co-located, we could, for example, constitute a group with the improvement goal of enhancing the care that was being provided in the after-hours clinic, so that we don't necessarily have to be part of the same practice. I even think that my problem-based small group learning group would be a great forum for putting forward a practice improvement that each member could participate in, even though many of us were working in different practice models. So it all depends what data you can look at together and individually in your own practices, and how you can formulate improvement goals that everyone can share in. I could just say that when you come together as a group, we help you to identify a QI lead spokesperson who can facilitate communication between the college and the group, and provide a bit of organizational support to the group. And I think we've seen a lot of very interesting ideas coming forward through the group subset.
That's great. Thanks, Dr. Manno. Dr. Everson, we have a partnership question, and the question is, can QI partnership be division focused?
Yeah, so the short answer is yes, and I can maybe put some context around that. So what an organization decides to do is flexible, and we leave that decision making to the organization. Now, when an organization and the medical leadership at an organization decides to pursue a strategy of multiple QI projects that could be at a department or divisional level, that's fine from our perspective, but we do ask and want to have some coordination and awareness within the hospital environment about what everyone is doing at that organization. So we look to one or two individuals, whether that is a quality lead or the quality division at an organization, or maybe at a smaller organization, it might be a chief of staff or a VP medical. We look to that leadership to provide some coordination of what their approach is and coordinating the coordination of multiple projects. I think the considerations to decide on that strategy are that when you get to the department or divisional level, you can really undertake some meaningful work for those physicians, but certainly you want to balance that with the resources and supports that you have available to implement and operationalize that type of project. So for an organization that may be submitting multiple projects, I would just ensure that you have the resources to support that. And so for a very, very large organization where, you know, departmental or division membership may be 50, 60, 80, 90 physicians, you know, that could make sense because there is likely QI support and physicians in roles that have protected QI time. Whereas for a much smaller organization, our experience to date has been that that is a challenging strategy because ultimately there is resources and supports required that may or may not be able to execute that and exist.
Dr. Manno, we have a question from Dr. McNevin asking if everyone in the group needs to be invited by the CPSO. Can you do it before being formally invited?
Thank you. Thanks for the question. So typically one group member is invited, and then they're welcome to ask up to 6 colleagues to join in. Those members do not have to be invited. Once they've been accepted into the group and the group has been structured, then when their participation is complete, then each group member will have met their CPSO requirement for a period of 5 years. What was the second part of the question, Mary?
No, I think you got it, Mary. I think that was
great.
The question. Yep.
Thank you.
I don't know that we have any additional questions. April in the chat has put a screenshot in about what to select in the drop-down menu. Excuse me. And so I'm hoping that answered the question from Dr. Bafundai. Are there any other questions? If there are, please don't hesitate to put them in the chat.
I see a hand.
So, Mary, I'm not sure if there's not any other questions. We still have time. I don't know if we want to do the demo of the online activities.
We do have one more question, Dr. Everson, and this is for Dr. Manno as well. So there's a question here: can we initiate a group without that invitation? As we know, we'll get an invite soon in the next 5 years.
You sure can. We would never discourage anyone from participating. So if you have some great ideas and you're keen to go, you'll fit right in. We're very enthusiastic here.
Great. And Dr. Everson, there's a question that's probably for you, I think, which is, what has been your experience with physicians doing locums? I'm assuming they mean a locum in a hospital, but maybe Dr. Mavropoulos can share with us if that's what the reference was. And there was a locum in an office, actually. That's what it says here, a locum in an office. So maybe Dr. Manno.
Sure. I'm thinking, and please feel free to unmute yourself and elaborate on the question if you like. Physicians doing locums don't have rostered patients, generally speaking, and some locums are short-term and some are more long-term. So it can be more challenging to find QI opportunities if we're thinking in terms of short-term experience. However, never say never. There's always a way. And for anyone who has questions about how to approach this in their practice. I and others, we're available to assist you in thinking through ideas. One way that I like to approach it is to think about, what does quality look like in my setting? What are the indicators for quality? How do I know I'm doing a good job? And that will often guide me and the participants in thinking about opportunities for improvement. So if I were a locum, for example, trying to judge how well I'm doing in my locum role, I might structure a survey of the last few physicians that I'd done locums for and ask them questions about how they perceived my work in their setting. That's just an example, but I think that the way we approach it depends on the setting. And for me, I always try to zero in on things that are meaningful and relevant to my own practice, and think about it from the point of view of each member's experience.
That's great, Mary. So there's no more questions in the chat at this moment. I think if you were going to head on to do the demo, this might be a good time to do that.
Sure. So what we thought we would do is just show you how some of the connecting with the CPSO looks online, just sharing some screenshots. So the QI activities are accessible through the member portal, and many of you will already be familiar with the big IT reno that's been going on at CPSO over the last couple of years as we engage in our own quality improvement. And this is the portal login page. I think it's fairly straightforward. And here's the tile that you'll want to click in. Once you've logged in, you're going to want to click on your quality improvement tile in order to access your home page. And this is what it'll look like. You'll see your name across the top and your CPSO number. That's reassuring. And you'll observe that you've been assigned a case number that pertains to your QI work this go round. Next slide. Next comes an overview of the QI program, which basically goes through the steps that you'll need to take in order to move through the QI survey and the 3 learning activities sequentially. And so let's go to the next slide, please. Step 1 is to select the stream that you want to participate in. So this person is participating in QI for individuals, for example. And then you have the option of selecting your submission due date, which is an important one because that will give you an idea of when your practice improvement plan actually needs to be submitted to the college. I should point out that the 3 QI activities in the learning management system are not submitted to the college. They are important and they're a great opportunity for reflection, but they're there for your own benefit and learning. We at the college will be checking to see that they've been completed, but we will not have access to the information that's contained in the activities. Those are there for your benefit. So far we've selected our stream. Now we're going to go on to look at the QI survey, which is the information that describes your practice so that we at the college can understand the setting in which you practice. Next slide. So the LMS, or Learning Management System, is the section of the program that houses the 3 learning activities. The practice profile, self-guided chart review, and data-driven QI sections. Next slide. So once you're in the learning management system, you'll see that the column on the left looks a little bit different, and it outlines the 3 learning activities There's also a place for you to keep your documents. There's access to resources and information about how to contact us. The QI coordinator staff at the college are fantastic, upbeat people who will help you navigate in case you run into any technical difficulties. This slide is showing us the practice profile reflective exercise, and then once the exercise has been completed, there's an opportunity to save the information in a PDF format so that you can go back to it as you're progressing through the program, or even further down the road if you just, I wonder how this relates a year from now, let's say. Next slide. We're getting down now to the practice improvement plan level, having completed the 3 activities in the LMS. And there's an opportunity now to think about how you're going to express those minimum of 2, maximum of 4 goals that will be included in your practice improvement plan. Next slide. So there, as I mentioned earlier, once you're describing your practice improvement plan online, there are stimulus questions that help you to express your plan by typing in these text boxes. So a place to start would be think about the change that you want to make in your practice. An example that's given here is, I want to improve my colorectal cancer screening rate. Would be important to express to the reader why you want to make that change. And we use the SMART criteria to guide us in expressing our goals. And SMART is an acronym that refers to specific, relevant, meaningful, attainable, and timely goals. Not in that order. I left out measurable. It's in there. So using the SMART criteria helps us to create goals that have a greater chance of being attained. And we know that from study of how adults frame their learning goals. The messages is an important aspect because we can communicate with one another through the portal. And next slide. I think that's the end of our demo. Any other questions or comments?
Yeah, there's been a few questions that we've answered in the portal. We've given everyone some just reminder about phone numbers and the email that people can call if they have any questions. We have had a question about the group invitations, which I think has been answered. We've also had a question about if you want to change your submission date. And I've answered that it might be possible for you to change your submission date. You can send in a request through the portal. You can also call and email the staff as well and have that conversation. We now have a question from Paul Hacker about what happens after we submit our practice improvement plan, the PIP.
So once a practice improvement plan has been submitted, it will be assigned to one of about 10 coaches here at the college who will review the plan in detail and provide written feedback. I think I mentioned that in 15 or 20% of cases, the coach may see opportunities to enhance the plan, in which case that individual will receive an invitation to attend a coaching session. And we do have the ability to provide more than one coaching session, but in most cases, a 45-minute discussion is adequate to assist a member in making some enhancements to their plan. Does that answer the question, Paul? I don't know if Paul
see,
has the ability to unmute himself.
no,
So
no,
please feel
they
free
don't.
to type again in the chat if I didn't nail that.
Yeah.
I see, Mary, that Dr. Adas Jamil has asked about, are there any specific resources for a radiology practice? And I think one aspect that we didn't share is that previously there were members of the college who did not participate in quality assurance for various reasons and are now being invited into the quality improvement program. So there is a shift in thinking, and it can be challenging to think about doing QI in a setting where you've been used to doing QA. And so we do have some experience now with radiologists participating in the program. So I would encourage anyone who has specific questions of that nature to feel comfortable to get in touch with me, and I'd be happy to have that discussion. And I think at the end of the presentation, we used to have a slide that showed our contact information, but we'd be pleased to share that with you. I can type my email address into the chat.
We have another question now. Do we have to keep checking for messages from the QI coach, or will they send an email first?
The coach will send the coach will take the initiative to send you a message. Okay.
Can I change information under my practice profile already submitted? Do you mean, I guess this is for Dr. Majovic. I'm wondering if you mean the practice profile or the practice improvement plan. The practice profile, as we've mentioned earlier, is submitted really for your own purpose. We don't look at that. If you're talking about the practice improvement plan, could you just in the chat let us know if that's what you mean? In the meantime, I've got another question for family physicians. Can you provide some ideas on what areas to focus on? And they're asking for some examples.
It's very variable, isn't it? Depending on the type of practice that one has and what one of our colleagues earlier today described as the pebble in your shoe. Are there specific things that you're encountering in your day-to-day work that interest you or perhaps challenge you or disturb you that relate to quality of care and that you would wish to improve? I think some of the quite a number of members are interested in improving their screening. And for example, if I know that the provincial average of screening for cervical cancer is 60%, and I look at my own data from Cancer Care Ontario and I see that my screening rate is 30%, then as a reflective practitioner, I'm asking myself why there is such a difference and what I can do to overcome the barriers that patients face in getting their pap test done. And that would be one fairly straightforward example. And I think there are many options and many ideas out there. It's a question of finding what's meaningful and relevant for you in your practice setting.
Okay, maybe this one's for Dr. Everson. Dr. Everson, there's a question from Dr. Hacker. Does the CPSO check to see if we have implemented the PIP, the PIP?
Yeah, so the PIP is related to the QI for Individuals program. So maybe Dr. Manno wants to comment on the follow-up and what would be advised on that.
At this point in time, we don't go back to ask you if you actually were able to have the desired outcome. That may well be built into the program in the future. At the time that the PIP is submitted, it's important that you tell us in detail what your plan is, but the plan doesn't have to have been the interventions do not have to be completed. You don't have to have outcome measures before getting to submitting your PIP. Some plans, for example, the example that I mentioned around PAP test screening, it could take a year or 18 months to see the outcomes of the interventions that I put in place to enhance the uptake of PAP testing in my practice. So the practice improvement does not have to be completed by the time of submission, I should say.
We do hope that you will complete your practice improvement plan, but we're not going to be checking in on you. We do have a question. So do we pull specific charts? How many, or is it overall stats using tools within the EMR? I'm assuming, Dr. Mizuka, that maybe you're referring to the self-guided chart review. Mary?
Yes. The activity involves looking at 5 charts that represent the nature of your practice, and then using a checklist, which is provided to look at the quality of your record keeping. And another important component is to, once you've had a chance to reflect on your own record keeping using those tools, to obtain feedback from a trusted peer around your record keeping, so that we can introduce an element of objectivity to that activity as well.
I think we don't have any further questions. We have some advice from one of our QI coaches, Dr. Beth Gamulko, who is just referencing Health Quality Ontario and the Institute for Healthcare Improvement in the States that have many different ideas for implementing QI in your practice. Oh, we have one more question here. Can we have more than 6 members in the groups program?
At the present time, we're limiting group size to 7 members. Because we have the infrastructure to be able to support that number of individuals. But as I mentioned earlier, we're on the journey of our own continuous improvement here. So stay tuned. That may change in the future. I guess one option would be if you're a member of a larger group, it would be possible to constitute more than one group. We do try to keep it to 7, but if there's a situation that requires an exception, we would certainly consider it.
Okay, I think
Yes.
that's it. There's no more questions, and I believe we're have 2 minutes left.
Great. Okay. All right. Well, again, thanks everyone for signing in and attending today. Hopefully, found this helpful and informative. A lot of the content and things that we covered are located on our website, cpso.on.ca, under our quality programs. And as I mentioned, we will have this. This has been recorded, and we'll have it saved and accessible as a future resource and to reference. So I think that's it. Thanks again, everyone, for attending, and take care and have a great day. Thank you.